Good morning, everyone. I'm Dr. Ruel. I'm a resident, and I'll be talking to you today about the influence of revised RNTCP guidelines on the prevalence of ethambutol optic neuropathy. I have no financial disclosures. As we all know, tuberculosis is a huge burden in India, and in 2019 alone, India reported 2.5 million cases of active tuberculosis in that 1 year. So the RNTCP, to eliminate TB, came up with the NTB strategy, and one of their protocols, one of the changes was to change the protocol of treatment of TB itself, and this came out in 2016. So in this revised guideline, the intensive phase was only, the ethambutol was given not only for the intensive phase, but also for the continuous phase. And from not only three times a week, it was changed to a daily regimen. So we hypothesized that this longer duration of ethambutol given would have a greater chance of developing ethambutol optic neuropathy. And our aim was to document this influence of the revised RNTCP guidelines on the prevalence of ethambutol optic neuropathy in a hospital-based setting. So ours was a multicentric retrospective descriptive study of new patients at the neuro-ophthalmology clinic at a tertiary eye care center in Tamil Nadu in 3 sub-centers, Madurai, Coimbatore and Tirunelveli, between Jan 2017 to August 2022. We included all new cases of ethambutol optic neuropathy that were diagnosed during this period. And those cases where there was a diagnostic dilemma, where the duration of ATT was not clear, were excluded. So we searched the electronic medical records for all cases with the history of taking ATT or were on it during this period in the 3 centers. And we got a total of 2,832 cases with a history of taking ATT. The same electronic medical records were searched for new cases of ethambutol optic neuropathy during this time among the 3 centers. And we recorded a total of 212 cases of new ethambutol optic neuropathy, as well as 41, out of which 41 cases came for a follow-up for at least 4 months after stoppage of ethambutol. So we calculate prevalence in each year by the number of new cases diagnosed with ethambutol optic neuropathy divided by the number of cases that had a history of taking ATT or were on it in that year. So we analyze the age, the gender, the comorbidities of the patients, the duration of exposure of ATT, as well as the visual acuity, both presenting and final. And these were our results. The overall prevalence increased from 1.6 to almost 3 times to 5.49% in from 2018 to 2019, and it further increased in 2020, only to fall back in 2021, which we attribute to the effect of COVID-19. Most of our affected individuals were males, and they were between the age group 31 to 70 years. They were equally divided between this age group. Diabetes and hypertension was the predominant comorbidity in almost half our patients. And ATT exposure was around 6 months. The mean ATT exposure of most of our patients before presenting with ethambutol optic neuropathy was around 6 months, with even 1 month of ethambutol, even after 1 month and even at the max 23 months presenting as well. And there was an average delay between time to diagnosis over 2 months. So patients were sitting at home with these symptoms for around 2 months. As you can see in this graph, only 8% of patients presented with ethambutol optic neuropathy within the 2 months, of which was the traditional protocol. Around the rest, 92% of cases presented in the extended spectrum of ethambutol being given. Visual acuity of most of our patients was 6/60, and the final vision was only 6/30 in those that came for follow-up. When we compared initial vision to the follow-up vision, we found that a better initial vision at presentation was predictive of better visual acuity, and those who presented with lower visions like 1/60 had a worse follow-up visual acuity. In this Kaplan-Meier survival curve, we compared time after ATT and the chance that they would improve after stopping ethambutol. And we found that after 6 months of ATT, there was a very low probability of visual improvement after stoppage of ethambutol. And those patients who were exposed to at least 6 months had a very low prognosis of improvement. I'd like to conclude by saying there was an increase in prevalence of ethambutol optic neuropathy, and duration of AT is highly associated, but this might not be the only factor. There's an avoidable delay to diagnosis of around 2 months, and this plays the role of awareness among patients. Ethambutol optic may not be completely reversible, as we can be seen by the final vision outcomes, and improvement of vision may depend on the presenting vision. Our limitations was it was a hospital-based study and cannot be applied to the community. And secondly, COVID-19 really affected our data collection. As a take-home point, there must be an increased awareness among all healthcare providers who are treating tuberculosis, and every patient must be educated on the possible side effects of ethambutol to avoid delay in diagnosis. These are my references, and I'd like to thank my mentors, Dr. Siddharth and Dr. Padmavati.